Hello, I'm James Taylor, president of the Heartland Institute. I hope all is well with you and your family. As I'm sure you've noticed, we as a nation have been on lockdown for well over a month. Millions of people have lost their jobs. Businesses have been forced to shut down. And trillions of dollars have been spent in relief aid. Many of our fellow Americans are struggling to pay the bills and feed their children, with no idea of where their next paycheck will come from. Their jobs, their very livelihoods, have been deemed non-essential by state and federal governments. The question is, non-essential to whom? For the small-town florist who is barely making ends meet, their job is essential. For the single mother of three who lives paycheck to paycheck, her job is essential. For the young entrepreneur who uses his ventures to take care of his elderly parents, his job is more than essential. In our ongoing battle against the coronavirus pandemic, we cannot afford to make the cure worse than the disease. The country needs to get back to work, where it is safe to do so we can restart our economy and reduce the damaging effects of the long national shutdown. While an extended quarantine may delay the severity of a viral outbreak, it also introduces a host of negative consequences. Studies have shown that long periods of quarantine lead to a dramatic rise in domestic spousal abuse, suicides, arrests, drug use, and even non-pandemic health issues such as cardiovascular complications. The Heartland Institute offers a solution. Our public policy team has consulted with dozens of health experts and economists to provide guidance to state and federal lawmakers on best practices for reopening their economies while protecting public health. The best approach to beating COVID-19 is a decentralized one. States and local administrations will know what kind of plan will work best for reopening their communities. To expedite this process, we recommend the following. First of all, be realistic. The virus will not go away until we reach herd immunity from infection or discover a vaccine, which could take months or even years, if ever. People will continue to get sick even as we return to normalcy. Governments need to be prepared for that fact and not base their reopening decisions on the unrealistic goal of perfection. Second, concentrate on problem areas. States should lift the stay-at-home orders immediately for all areas not clearly requiring a quarantine. The economic and public health damage done by these statewide bans on non-essential activities are far greater than anything the shutdowns could possibly accomplish. Third, protect vulnerable populations. We can protect individuals in high-risk categories while also protecting the rest of the population's right to determine the level of risk they are willing to accept. Many businesses, such as assisted living facilities, already had health and safety precautions in place prior to the initial outbreak of COVID-19. Blanket coronavirus shutdown rules that place other businesses and establishments under these restrictions should be removed. Fourth, let employers and workers manage themselves. Governments should let individual employers and employees decide what is best for keeping workers safe. Employers were already taking precautions before states started imposing shelter-in-place orders, and they will continue to do so without government mandates for a variety of reasons, including public health and protection against liability. Fifth, consider reopening schools, public parks, and hospitals for elective surgeries. Parks are a vital source of socially distanced recreation and instrumental to good mental and physical health. School-age children are relatively unaffected by the virus. Lawmakers should recognize that the costs of keeping children at home likely exceed the public health benefits. Elective surgery and other important healthcare procedures, such as dental work, should resume as soon as possible in all areas not subject to quarantines. Many healthcare providers in low-risk areas are losing their livelihoods, with few or no COVID-19 cases to treat and no other patients being allowed to schedule appointments. Heartland is working directly with policymakers to bring these ideas to reality. If you would like to know more about the Heartland Institute, or how the Heartland Institute is helping our nation's leaders reopen America, I encourage you to visit our website at www.heartland.org. And if at all possible, I would ask that you make a donation to support our continued efforts in providing guidance to our elected officials in these uncertain times. Together, we can get our country back to work. Thank you for helping us fight for personal freedom.